days one should expect the hair to grow after transplant?
Yes, we should not expect about the immediate growth after hair transplant procedure. It will take around 7 to 8 months.
7 to 8 months?
For complete results.
Okay.
So in between what happens is within 3 to 4 months the hair shedding starts. As root remain intact, the shaft will get broken and it will shed. And after that degrowth occurs. And it completes the cycle within 7 to 8 months. So after up to 7 to 8 months we can see a complete results for hair growth.
Okay. Then within this period of time, is there something which should be done by the patient during this time? This 7 to 8 months time, is there any protocol which has to be maintained or something like that?
Yes, the patient is advised to take nutritional supplements that is provided from our clinic, Dr. Paul's. It's about hair fat and other treatments also suggested according to patient's conditions like PRP and also laser therapies.
Okay, PRPs are also done.
Yeah, so that it enhances the hair growth, it nourishes the hair follicles, and we can see a beautiful results after 7 to 8 months.
Does someone need to carry out all this process for lifelong post-transplant?
This is a bit thing like that. You have to take medicines for 1 to 2 years.
Okay.
After that, if the hair growths occurred fully and patient see the expected results is come out successfully, then you have to maintain a proper hygiene and all, and the guidance from our clinic's experts, so that he can carry it out. The necessities, if it is necessary to take medicines in the post operative phases, he can. Otherwise, it is completely decided by the clinicians whether you have to take or not.
Okay. Medicine means what kind of medicine?
See, these are medicine like these are nutritional supplements which enhance the hair growth, proper hair supplements.
Okay, right.
As see, in our busy life, we cannot follow the proper nutritional supplements particularly for the hair growth. So sometimes it lag behind. So after the successful surgery, I've seen the patient has followed this for 1 or 2 years, all things good and fine, but after that he forgets. So we need to take care of the thing he has already invested or he has planned for the next years to follow like that.
Okay, so depending on the condition of the patient, this nutritional supplement timing can be increased or decreased?
Yes, it depends on the patient, how the growth is there.
Okay.
Is there any other pathologies developed by patient or not? Other medical conditions like patient has developed in the future, like any diabetes or any thyroid problem. So it becomes a properly, patient have to do a regular checkup and all to know his what is the condition going on right now. So as you have done a surgery, it's not like that everything is
it cannot be forgotten.
We have to need a good suggestion from doctors how to maintain all these things. So in this way, I think patient may.
There should be some follow-up kind of things with
Yes.
the clinic and all.
Right,
They should be kept in touch with us.
Right.
Is it a one-time procedure?
We take full day for the procedure, and in one single procedure, we try to implant around 3 to 4,000 grafts.
Okay.
But if we require more grafts, we take multiple sessions.
Okay. So if somebody's need is in between 3,000 to 4,000 grafts, this can be a one-time procedure.
Yes, we can do this procedure in a one day in one session.
If more than that is required for
If
a
a patient required really like 6,000 grafts, 5,000 grafts, we divide the session in a multiple session. Accordingly, we do.
Generally, how much gap is needed between these two sessions?
It's fully depend on the patient's quality of the hair, whether we can take very next day or we may wait for 3 to 4 months for the multiple sessions.
Dr. Sanjay, can we use body hairs like from hands and legs? There are people who are very hairy in these parts. Like even some people have got lot of hair on their back also, but they don't have that much of hair in their donor area. So can we use them?
In the case if patient doesn't have a good quality hair in the donor area, we usually suggest for a transplantation in the form beard region. As beard have some good quality of hair that may be implanted on the recipient side, but in case of other body hairs like goes on hands, legs and other parts of the body, we usually don't recommend, because the quality of hair we get from the region on the other body parts doesn't fulfill the quality of hair we want to grow in the recipient region.
So now we know, no matter a person how much hair he is, body, hand, leg and back hairs cannot be used for hair transplant. After how many days one can resume their normal life? Like how many days someone need to take leave from their office? After the hair transplant, one can join office after how many days?
One may join his regular work like office and any other activities, usually from 5 days to 7 days. After that, removal of the bandage within after 3 to 4 days, patient may develop small swelling. So it is recommended to avoid other activities like going to office and other works for 7 days. And after that, he can go out, do his regular activities, maintaining all other advisable condition as advised from the clinic. So he can join his work and daily activities after 7 days. We always recommend to avoid any strenuous jobs like exercises, workout, swimming, maybe after 1 or 2 months.
Is it recognizable, Dr. Sanjay, if somebody has done hair transplant? Can anyone look at the person and understand that he has gone through hair transplant?
Immediately after hair transplantation, so up to 15 to 20 days, it is recognizable that he has undergone hair transplantation surgeries. But after that, when the scabs are being removed, it will appear like a normal hair trimming, or it feels like a patient has undergone a normal haircut or hair trimming. So after that, it looks like normal, everything is normal.
Okay. That is wonderful to know that transplanted hairs are not recognizable. Whenever we talk about hair transplant, it sounds a bit pricey. Why it is so, Dr. Sanjay?
Hair transplant procedure is a surgical procedure where we need a proper setup, a good supportive team, an experienced doctor and specialized in this field, and we maintain a high quality sterilization protocols and all. And for anesthetic purpose also we used painless anesthetic devices to meet up all these demands. Hair transplant is become a bit pricey, so if a patient thinks it becomes very expensive for him to have a good qualified clinic setup, successful results, I think it is a good investment. And we are confident about our work and fulfill all the parameters for proper successful surgeries.
Thank you so much, Dr. Sanjay, for giving us so much of time and knowledge. I hope we are through with hair transplant questions.